Hello and welcome. Today we're diving into the world of ophthalmology to explore a rare, inherited eye condition called Meesmann Corneal Dystrophy. We'll uncover its origins, how it affects vision, and what options are available for managing this fascinating and sometimes challenging disease. Meesmann Corneal Dystrophy, often abbreviated as MCD, is primarily caused by genetic mutations. These mutations occur in genes that provide instructions for making proteins crucial to the structure and function of the corneal epithelium. The most common culprits are mutations in the KRT3 and KT12 genes. These genes provide instructions for making keratin proteins, specifically keratin 3 and keratin 12, which are essential for maintaining the integrity and transparency of the corneal epithelium. Because it's a genetic condition, Meesmann Corneal Dystrophy is inherited, usually in an autosomal dominant pattern. This means that if one parent has the affected gene, there's a 50% chance their child will inherit the condition. At the heart of Meesmann Corneal Dystrophy lies a disruption in the corneal epithelium. The mutated keratin proteins lead to abnormal cellular structure and function within this layer. Specifically, we see the development of numerous tiny, clear, bubble-like cysts within the epithelium. These cysts are filled with cellular debris and abnormal keratin. Over time, these cysts can rupture, causing epithelial erosions. These erosions can trigger inflammation, discomfort, and even temporary vision disturbances. The cornea's normally smooth surface becomes irregular, impacting how light enters the eye and focuses on the retina. Meesmann Corneal Dystrophy is considered a relatively rare condition. It affects individuals of all ethnicities and genders, but it doesn't show a specific predilection for any particular group. Because it's a genetic disorder, it can appear in families with a history of the condition, but it can also arise spontaneously due to a new gene mutation. The exact prevalence is difficult to determine as many individuals may have mild symptoms and remain undiagnosed. The signs and symptoms of Meesmann Corneal Dystrophy can vary greatly from person to person. Some individuals may experience no noticeable symptoms, particularly in the early stages. However, as the condition progresses, common symptoms include a blurred vision, sensitivity to light, photophobia, excessive tearing, a gritty or foreign body sensation in the eye, and episodes of eye pain, often associated with corneal erosions. The severity of these symptoms can fluctuate, with periods of relative comfort interspersed with flare-ups of discomfort and visual disturbance. It's important to note that the symptoms tend to be more pronounced during waking hours due to the drying of the cornea. Diagnosing Meesmann Corneal Dystrophy typically involves a comprehensive eye examination. An ophthalmologist will use a slit lamp microscope to closely examine the cornea, looking for the characteristic epithelial cysts. These cysts appear as tiny, clear, bubble-like lesions within the corneal epithelium. In addition to slit lamp examination, other diagnostic tests may be used, including corneal topography, which maps the surface of the cornea to identify irregularities. Genetic testing can also be to confirm the diagnosis by identifying mutations in the KRT3 or KRT12 genes. A thorough family history can provide additional clues, as the condition is often inherited. While Meesmann Corneal Dystrophy does not have distinct subtypes in the same way as some other corneal dystrophies, the severity and presentation of the condition can vary significantly between individuals and even within the same family. Some individuals may have a greater number of cysts, more frequent corneal erosions, or a more significant impact on their vision. These variations likely reflect the specific genetic mutation involved, as well as other genetic and environmental factors that can influence the disease's progression. Currently, there is no cure for Meesmann Corneal Dystrophy, so treatment focuses on managing symptoms and preventing complications. Lubricating eye drops and ointments are often used to keep the cornea moist and reduce discomfort. In cases of recurrent corneal erosions, bandage contact lenses can protect the cornea and promote healing. For more severe erosions, debridement or phototherapeutic keratectomy (PTK) may be considered. Debridement involves removing the damaged epithelial cells, while PTK uses a laser to smooth the corneal surface. In very rare and severe cases, a corneal transplant may be necessary to restore vision. Since Meesmann Corneal Dystrophy is a genetic condition, there are no specific measures to prevent its occurrence. However, genetic counseling is available for individuals with a family history of the condition who are considering having children. Genetic counseling can help individuals understand the risk of inheriting the condition and discuss options for family planning. The prognosis for individuals with Meesmann Corneal Dystrophy is generally good. While the condition can cause discomfort and visual disturbances, it rarely leads to significant vision loss. Symptoms tend to remain relatively stable over time, although they may fluctuate in severity. Ongoing research is focused on developing new treatments for Meesmann Corneal Dystrophy, including gene therapy, which aims to correct the underlying genetic defect. Scientists are also investigating new ways to prevent corneal erosions and improve corneal healing. These advancements offer hope for improved management and potentially even a cure for this condition in the future.